Fight Back with Libby Znaimer on Zoomer Radio with guest host Jane Brown.
Libby will be back tomorrow. So once you've received both doses of a COVID vaccine, are you good to go? What does it mean for you? Should you still mask everywhere you go? Can you make plans to travel outside the province or country? We're still awaiting guidance from the Trudeau Liberals on how we are to conduct ourselves once we've been fully vaccinated with 2 doses. Joining us to discuss, Dr. Iris Gorfinkel still with us, as is epidemiologist Dr. Raywat Deonandan, Associate Professor in the Faculty of Health Sciences at the University of Ottawa. Dr. Ray, thanks for joining us. Dr. Iris, thanks for hanging on.
Thank you.
Thank you.
So in the United States, Dr. Ray, the Centers for Disease Control in the middle of May offered guidance saying that mask wearing could be eased for fully vaccinated Americans, allowing them to stop wearing masks outdoors in crowds and in most indoor settings. It also, the CDC provided a list of activities that are safe for vaccinated people but could be risky for those who are unvaccinated. What is your opinion on the timing for this kind of guidance from our government?
Well, we need something, but it has to be well-tempered. And the CDC guidance, in my mind, was a bit premature and a bit problematic. So a UK scientist tweeted earlier this week about the Delta variant in that country experiencing exponential growth. And the first response to that tweet was from another UK citizen who said, "What do I care? I've had my 2 doses. Let me get on with my life." And that to me underlines the problem with understanding what you can do. What you can do with 2 doses depends incredibly on what's happening in the community. It's not just about whether or not you had your vaccine. It's one of the indicators of transmission in where you live. So that's difficult to create guidelines at a federal level if it depends on what's happening locally. So I'd like to see something around 3 sets of indicators. There's how many people in your community have been vaccinated? Are you vaccinated? In addition to that, what is the status of the epidemic where you are, with the reproduction number, the incidence rate, and so forth? Also, what's the hospital capacity? That's going to dictate what businesses can do. For example, can Hollywood studios start filming in Toronto, even when the numbers are down? If the hospital beds are still occupied, their stuntmen might get injured, and they can't risk that. Right? So there's a lot of stuff happening here, and it's a little problematic to simply say, if you've had 2 doses, these are the things you can do. It's more complicated than that.
Would it be something that the individual public health units could offer as guidance, or even provincially, or are we getting into it's still too broad of a territory?
Well, I think it's still possible for the federal government to offer guidance, but it has to be a broad framework. Sort of like, if the disease has this characteristics where you are, if you've had 2 doses, and if this percentage of people where you live have had 2 doses, then these are the kinds of things you can do. Now, that might be too complicated for a lot of people to digest or even want to hear, but unfortunately, that's the most responsible scientific way to do this. What the CDC has done, while it is popular, has created some issues. For example, if you say that if you've had 2 doses, you can take off your mask, suddenly you're in a pub, people take off their masks. How do you know they're the ones who've had 2 doses? Right? No one's taking a poll in the room about how many people have had 2 doses. As well, 2 doses does not guarantee protection. The analogy I make is vaccination is like wearing high boots in floodwaters. If the boots are perfectly impenetrable, that's great. But if the floodwaters are high enough, they're going to get over the lip of your boot and get your feet wet. So it matters how much disease is present. That will determine how safe you are with your vaccination.
What about you, Dr. Iris, in terms of having some sort of framework for easing of mask wearing foremost, I guess?
It is extremely hard to have a one-size-fits-all. There's 2 issues. Can they give guidance? Yes, they could. Can they give detailed guidance? Even if they gave granular guidance, the problem of how are we going to enforce it? Who's going to card people and say, show me that you've had 2 doses? And that represents a serious threat. And the Delta variant is not to be underestimated. How much more contagious is it? It is practically 2.5 times more contagious than the original variant. Are any of these vaccines perfect? Absolutely not. And how many of us have full protection? Actually, a very small minority. So that's a serious problem. We have to have, for this variant, we're probably looking at, realistically, anywhere between 80 to 90% of people being fully vaccinated, 2 doses, to have real protection in terms of herd immunity, to really prevent spread. I'm not surprised our federal government has been a bit slow on issuing guidelines. I completely agree with what I'm hearing from Dr. Ray. You can't really do that. I think the CDC was extremely premature in saying, oh, you don't need masks anymore. I don't agree with that. I think even after being fully vaccinated, until enough of us are fully vaccinated, the responsible thing to do is to continue wearing masks, to continue social distancing. Now, what about vaccinated with vaccinated in indoor settings? I think that's probably safe, but we have to be very cautious about generalizations about just take off your masks and forget social distancing. I do not believe in that.
Okay, let me get a quick comment from Murray in Milton. Murray, what would you like to add?
Hi, Jane, how are you? It's Milton anyway, but I agree with both these speakers. I keep going back to the brass whale where they had 450 people exposed to the virus and only could contact like 120 of them.
Yeah.
So if people aren't going to be honest, I don't think we should give up the masks at all until this thing is all over. But if the government's going to impose something, I think it should be around 70% double vaccination.
Well, we're almost getting to the point where I have to get final comments from you. Dr. Ray, here in Canada, Ontario, Southern Ontario, we are all, for the most part, used to and accepting of mask wearing in all kinds of situations. So I'm not really hearing from people that they want to stop wearing their masks. In fact, most people are like Murray and are quite happy to keep wearing them just for protection.
Yeah, that's great news. We're not the Americans. We keep hearing American data, American news, American systems. We're not them. We're quite different. And I want to say that I fully agree with Dr. Ayers. I think two fully vaccinated people can probably interact indoors by themselves. It's the other stuff on top of that that's more complicated. So I don't know what to say anymore, except I think we have to keep in mind that this is almost over. Let's not mess it up until it's fully over. We always have the potential to trigger a small fourth wave. I'd like to avoid that if possible. So let's not be premature. Let's be consistent and responsible and conservative with how we unroll the economy.
And you know, really, I mean, none of us, or those of us who have not gotten COVID, we haven't gotten anything else either, Dr. Irish. The masking, the distancing, this hand sanitizing has really kept us from being sick.
It's made a tremendous difference. And moreover, we should avoid a model that says reward those who have been vaccinated and punish those who haven't. I worry about that. Masks are not a punishment. Masks are a public health effort. We are truly all in this together. And I don't mean just as a province or as a country. I mean as a globe, we are in this together.
Right.
So
all right.
Sorry?
And I was just going to say I'll leave it there, but you have one more comment?
Yes. And so if we consciously move away from a model of reward those who have been fully masked or fully vaccinated, and in fact move better toward a model of global understanding, it makes a tremendous difference. That's how you really keep world pandemics down.
Very good. I thank you both for your time and your perspectives. Important information at this point in the pandemic. Thank you.